Patricia Martin is the sleep navigator at the Valley Hospital Center for Sleep Medicine. Patricia has a degree in respiratory therapy and has worked as a polysomnographic technologist. She has worked in the medical field for over 10 years, as well as work in health insurance. Patricia's role as a sleep navigator consists of providing education and promoting sleep apnea awareness information with both our inpatient and community population via outreach events. Welcome, Patricia.
Welcome, and hello, everyone. I'm really happy for this opportunity to share with you today. And I'll get started talking about sleep apnea. And as you see in my first post here, sleep apnea, the not so silent epidemic. And that's a little spin on silent because snoring, that's where it's not silent because everyone has been exposed, can hear the noise of snoring. There is a high prevalence of sleep apnea among African Americans, and even worse, the majority is nearly 95% that go undiagnosed and untreated. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. It can affect people of all races and genders, but there are certain demographic groups, including African Americans, men and women, who may be at a higher risk. Several factors contribute to this increased risk among African American individuals. Genetics may play a role. Some studies suggest that certain genetic traits prevalent in African American populations may predispose them to sleep apnea. Additionally, there are social economic factors such as limited access to health care and disparities in health care quality and awareness that can affect diagnosis and treatment. Also, treatment rates. Obesity is a significant risk factor for sleep apnea. Unfortunately, Black Americans, particularly women, have higher rates of obesity compared to other racial and economic and ethnic groups in the United States. Obesity can contribute to the narrowing of the airway, increasing the likelihood of breathing difficulties during sleep. Moreover, lifestyle factors such as smoking, excessive alcohol consumption, which are more prevalent in some Black communities, can also exacerbate sleep apnea symptoms. Awareness of these risk factors and access to the health care are crucial in addressing sleep apnea in our community. Health education, regular checkups, promoting healthy lifestyle habits can help mitigate the risk and improve management of sleep apnea in these populations. Let's see. Now, helping you break through the barriers. And I believe this opportunity for me to speak with you is helping you break down some of the barriers that may contribute to you not seeking your doctors, speaking to your primary care doctors. Limited access to health care. Black individuals may face barriers in accessing health care due to factors such as lack of I apologize here. Such as lack of health insurance, geographic disparities in healthcare availability. Without access to regular medical care, individuals may not receive timely diagnosis or treatment for sleep apnea. Without access to regular Medicare, individuals may not receive awareness and education. There may be lower levels of awareness and knowledge about sleep apnea and its symptoms within Black communities. The lack of awareness can lead to under recognition of symptoms and delayed diagnosis. Additionally, misconceptions or stigma around sleep disorders may discourage individuals from seeking medical help. Culturally and language barriers, cultural factors and language barriers can affect communication between patients and their healthcare providers, making it even more difficult to convey symptoms and understand treatment options. Lack of culturally competent care may also contribute to disparities in diagnosis and treatment. Distrust of the healthcare system, historically, and systematic factors such as experiences of discrimination and medical mistrust may lead to skepticism or reluctance to engage with the healthcare system. This distrust can hinder individuals from seeking care for sleep apnea or adhering to treatment recommendations. And also, finally, financial constraints. The cost of diagnostic tests, equipment, and ongoing treatment for sleep apnea can be prohibited for individuals with limited financial resources, even with healthcare insurance. Out-of-pocket expenses for copays, deductibles, and ongoing supplies may pose significant challenges for Black individuals and families, for African American individuals and families. And also lack of provider awareness and bias. Healthcare providers may not always recognize the signs and symptoms of sleep apnea, and in our community, leaders leading to underdiagnosis or misdiagnosis. Additionally, implicit biases and stereotypes held by some healthcare professionals may affect the quality of care and treatment recommendations provided to individuals. Is a lot of misinformation and disconnection as to being diagnosed with sleep apnea. What is sleep apnea? I show there is some PowerPoint points where there's a flow. Flow is when you're breathing, and it shows it going up and down. That's your breathing. Inhale, exhale, and then you may snore, which is a little brief, which is a narrowing of the airway. During that time, it's called obstructive airway because now it interrupts with the flow, and there's a snoring where you see right here, there's snoring going on right there. And then it's a drop, and then a snoring again, and then there's silence. Where you see the straight line, that's where the apnea is going on. That's what's happening at the point where we talk about sleep apnea, which is that 10-second pause during the hour. It may be as high as 15 times within 1 hour while you're sleeping. And that's really very concerning because if you stop breathing, it's labeled as sleep deprivation. And sleep deprivation meaning your body is not able to exchange the oxygen throughout your heart, your brain, and your organs. Okay. Moreover, lifestyle factors such as smoking and excessive alcohol consumption, which are more prevalent in some communities, can also exacerbate sleep apnea symptoms. Awareness of these factors and access to health care are crucial in addressing sleep apnea in men and women of our community. Health education, regular checkups, and promoting healthy lifestyles and habits can help mitigate the risk and improve management of sleep apnea in these populations. Sleep apnea, repetitive blockage, obstruction of the airway during sleep, up to hundreds of times during the night. Obstruction, drops in blood oxygen level, and brief awakenings, multiple awakenings, which results in daytime sleepiness. Low oxygen levels, which also leads to heart and brain stress. Some consequences of sleep apnea, as you can see the gentleman driving, separating at a traffic light, and just close your eyes. I think some people have experienced that, just closing eyes for just a moment, just to reset. And that can be pretty dangerous for some folks. We hope that never happens to any of you here. High blood pressure, which is 50% of the consequences of sleep apnea. Coronary disease, heart attacks, is 2 to 4 times risk for sleep apnea. Cardiac arrhythmias, such as death and congestive heart failure, also a result of consequences of sleep apnea. Stroke, 2 to 4 times a risk if you are diagnosed or you're undiagnosed with sleep apnea. Diabetes, Complications of anesthesia and surgery. Believe it or not, that when you're having surgery and going under anesthesia, and if you have undiagnosed sleep apnea, that can also affect your operation process, the surgery process. Car crashes, which is 3 to 7 times even more prevalent because of sleep apnea. Shortened lifespan. They're saying it by 11 to 12 years, you can shorten your lifespan if you remain undiagnosed and untreated for sleep apnea. Sleep apnea hurts hearts. And as this shows, it breaks it down with each letter being identified as H being the heart failure, E, elevated blood pressure, A, atrial fibrillation, AFib, some people may know it as, R, resistant hypertension, meaning even though you're taking medicine for your hypertension, it still goes out of control or remains out of control. And that connects to the breathing. When you stop breathing during the night, which is obstructive airway, that can also cause your blood pressure to go higher. Type 2 diabetes. That's identifying T in the hearts, and S, stroke. Screening summary. Obstructive sleep apnea, OSA, screening is a quick and high-yield intervention for all individuals at risk. Utilize the stop bang and Epworth sliding scale for early diagnosis of obstructive sleep apnea. Make sure documentation is present so studies will be approved by insurance. Some of those diagnoses are studies that can be done. Usually they need indications such as snoring, obese. Snoring and obese is not enough for insurance to approve a study. So in the event that you go to your doctor and you identify that you may have sleep apnea, it can't be just snoring and obese. The insurance will not cover that. So you want to make sure that you identify some other symptoms as well. When in doubt, see a sleep doctor. Our sleep doctors are board certified specialists, and they're able to walk you through and identify some things that you may not have noticed. But if you bring it to the doctor and have a consultation, it'll help identify some things that you may have overlooked because you just didn't know. The screening that I mentioned is called stop bang. Stop, S, identifying snoring. T is for tiredness and sleepiness. Always for observed apneas. And when I mentioned, if your bed partner noticed that in your snoring, and there's a brief pause in snoring, it may go escalate, and then it just silence, then it escalates again with like a gasping sound. That's observed apneas. Pressure, blood pressure elevation, or for type 2 diabetes. Body size, body mass index, which is a measurement of your weight and your height, how that should coincide with the proper, what they say, let's say should be your proper height and weight and coordination that will determine whether you're obese or not. Over 50. The neck size. For men or women, size 16 inches or 17 for men. And also, most men are diagnosed with obstructive sleep apnea overall statistics. 3 out of 8, 81% of chance of having sleep apnea. If you get 3 out of 8, meaning any one of these snoring, tiredness, observed apneas, 1, 2, 3, it's 81% chance of having sleep apnea. And 5 out of 8, high probability of moderate to severe obstruction apnea. So any one of these, snoring, tiredness, sleepiness, observed apneas, blood pressure, you've been diagnosed with high blood pressure, and your body size, obesity, would be a higher probability of moderate to severe sleep apnea or obstructive sleep apnea. Then we also have home sleep apnea testing. And one is in lab, where most people are familiar with going into a sleep lab and sleeping overnight. But we also have home sleep studies as well that can be used to diagnose moderate to severe sleep apnea in an uncomplicated patient without comorbidities. As we spoke, comorbidities equals high blood pressure, congestive heart failures, any heart failures. Those are some of the comorbidities, also a stroke or CVA. Home sleep studies cannot diagnose any other sleep disorders. It only basically monitors your sleeping, your flow, and just kind of determining whether or not you have sleep apnea. The home sleep study test is an option if patients cannot or will not do the in-lab test. I highly recommend and advise that you do try the home test. That's actually after speaking with your doctor, and they may suggest you can do a home sleep study. And with the home sleep study, it can rule in or rule out what's going on with your body and your sleep routine. In the event the doctor decides that he wants you to have an in-lab study, he can then use this data, this information, to explain why he would rather you have a sleep study done in the hospital. At the sleep lab, the sleep lab. Diagnosis of sleep apnea. There's 4 types of sleep studies for OSA. OSA, obstructive sleep apnea, available at the sleep center. And as I mentioned, in lab, that's the gold standard. The home sleep apnea testing, which you can bring at home and sleep in the comfort of your own bed and wear a device that will monitor your sleep right in your own comfort of your own home. A WatchPad home sleep apnea test. And I believe I have a sample of that as well. And then the last one is Whisper. And that's one of the new devices that we have on that we're utilizing even now as we speak at our sleep center. As I mentioned, the Whisper, it's actually a device that you can place right over your belly button and also right under your rib cage. And then you would wear a monitor on your finger as well as like a pulse ox. But all of that will be explained to you when you receive the device and you take it home. You will get information on how to utilize that. The most common one that we're using right now is the WatchPad. And that's a monitor, a pulse ox on your finger. It's a watch-like device that goes around your wrist. And then you have another wire that fits right on the bony part here. And with that, you would actually thread the wire through your sleeve, and then you'll put that wire right there. You click on the button, you turn it on, it says good night. And then at that time, it starts to monitor your sleeping. And in the morning, you will turn the device off. You'll click it again, and it'll say good morning. That information is transferred over to your doctor, and then they're able to read that information and diagnose your sleep if you have sleep apnea. Also, there's another device as well that, and this is for airflow, where you actually wear a nasal cannula under your nose and also a belt. And this gives more information that some of the doctors may need when they're trying to diagnose sleep apnea. So that's always another tool that's used to get a better diagnosis for some patients, if recommended. Obstructive sleep apnea, the benefits of treatment: hypertension control, blood pressure, cardiovascular mortality, motor vehicle accidents. So there's the benefits of being diagnosed and adhering to the treatments that's given to you. Stroke, your quality of life is better. Diabetes and neurocognitive dysfunction, which is the brain fog. Some people can attribute to Alzheimer's or dementia if you go undiagnosed with sleep apnea. That can eventually affect your cognitive ability. Treatment of sleep apneas. We also have a device which is a dental device, or oral appliance. We have board certified doctors as well that specifically work with the oral appliances, and they're dentists that we are affiliated with. We have a list of doctors as well for that, if that's an option treatment that you would like to explore. And then we have the nasal cannula, the nasal mask. This is a mask, a CPAP mask. A CPAP mask is a continuous positive pressure, and it's a mask that you wear. This is called a nasal, and that fits right under your nose and the headset over your right over your head. And then there's a hose that goes out, extends outside. And it's a lot easier for a lot of patients when they're sleeping. They can move their head from side to side because this allows them to have unrestricted movement. And most patients like that particular CPAP. Medical treatments is to stabilize or increase the size of your upper airway. Nasal CPAP pressure support, splint of the airway, and oral appliances. Bongo is another treatment. It's actually a device that goes into your nostrils. FDA approved for mild to moderate sleep apnea. And it's a small size, portable, 4 sizes, small, medium, large, extra large. It has it's reusable up to 90 days. So you can discard it and get another set. The cost is about $200 for starter kit with one of each 4 sizes, and $300 for a year for a pack of the same size. Now, this particular device and this treatment is not covered by most medical insurance plans. So that's an individual personal decision that you may want to make. You have the option: treatment of sleep apnea, lifestyle changes, avoid alcohol, avoid muscle relaxants and sedatives, avoid sleeping on your back, weight loss. A lot of patients have been very successful in getting weight loss treatments or losing weight, and that has tremendously helped some patients with their sleep apnea. Many patients that I've spoke to have lost maybe 40 to 50 pounds, and they've been told by their bed partners that they no longer snore as loudly. So those are other treatments for sleep apneas as well. Treatment of sleep apnea surgery. Some individuals go the route of surgery, throat surgery, to increase airway size. Obesity surgery, and we've heard bariatric. That's referring to that for weight loss. There's even surgery, bony jaw surgery, to increase the airway, where there's surgery is done on your jaw. And hypoglossal nerve stimulation. That sounds like a big word, right? But hypoglossal nerve stimulation is what you see on the commercials pretty much every day, and that's Inspire. And that's where it shows the Inspire is surgically placed above your clavicle. And then there's a voltage that that goes through that assists to the nerve, and it causes the airway to close and open and close. So that's surgical device, if that's the route you choose as well. And we have a doctor that also will walk you through and talk you, and the eligibility criteria for that. We have a doctor that can assist you with determining your eligibility for such a device. Sleep centers play a vital role in diagnosis and treatments. And the last is this: make your room, if you're saying, I don't want all this intervention, I just want to sleep good. Can you help me with that? You can make your bedroom a slumber factory. I love this particular PowerPoint because it says you can paint your bedroom blue. People who surround themselves with this calming color log more hours of sleep than those who decorate with other hues or other colors. Engineer the sounds. Power on a fan or a white noise machine to block out the rogue car alarms or other nighttime disturbances. Do your laundry. I don't know about that one, but a full 75% of people say they sleep better when their sheets have a fresh, clean scent. So you make sure your bed linen is fresh and clean. Keep the temperature right. Keeping your bedroom at a brisk 60 to 67 Fahrenheit degrees may be the key to a good night's sleep. Also, use scent, aromatherapy. That's very much you can see it on commercials and places of that nature, places where you can get aromatherapy that will assist. I hear lavender is pretty good for that. Lowers heart rate and blood pressure and leads to more restful sleep. And then make your bed. What would you rather get into? A neat bed or a set of tangled sheets. That tells last night's sordid sleep story. So going back to the nice, neat bed, clean sheets. So this is just some of the recommendations that you may want to entertain in the event you a little hesitant about seeing a doctor. But a good laugh and a long sleep are the two best cures for anything. I hope this information has been helpful for you. As I mentioned, we have board certified sleep specialists affiliated with the Valley Hospital. We have our medical director, who is Jeffrey Barish, who is our medical director. Also, Lisa Finnegan, who is the practitioner that works with Dr. Barish. We also have another doctor, Dr. Salamat, and her office is located in the Ridgewood area as well. And we also have two locations in Wayne, New Jersey, where we have a Dr. Matalka, and their office, one is on Route 23, as well as his office on Hamburg Turnpike in Wayne, New Jersey. So this is some information that will be helpful to you if you want to have an appointment and have a consultation. We really appreciate you making the move to speak to someone in reference to this. If any of this information has led you to believe that you may have sleep apnea, the best thing is to make a phone call and get started on your journey to better sleep. I want to thank you for your time and wish you well.
Thank you, Patricia. I'd like to let everyone know, if you do have a question, you can enter it in the Q&A box at the bottom of your screen. I actually have a question for you while we're waiting. Melatonin. I have recently discovered melatonin. Does that really work, or is it a does melatonin really work for sleep, or is it just kind of the suggestion and that's why I think it works?
Well, that's a twofold. Thank you for that question. Actually, it's a good question. It's two-folded. For some people, taking melatonin, it allows them to sleep quicker. They fall asleep faster. And for that, if they get the results they're looking for, they feel like that's a win-win situation. But over time, over time, melatonin will no longer have an effect on your sleep. And most patients will notice, most people will notice that they're not getting the same effect of going to sleep right away. So that's why we recommend that you speak to your primary care doctor or call one of our board certified doctors, sleep specialists, to kind of delve further into why you're not getting the sleep that you so need. So I hope that answers your question.
It kind of makes me a little sad. Thank you. Okay, another question is, what do you suggest if you can't get to sleep, or if you wake up in the middle of the night? Is it better to just get out of bed and start your day, or is there any suggestions that you have for trying to get to sleep?
It's been suggested that if you're laying in bed and you just can't fall asleep, to get up. Get up, and as one of the suggestions was on the do laundry. I don't suggest everybody does laundry, but you might want to get up. You might want to watch one of the TV, or turn on the television and watch one of the shows that's on TV until you find yourself falling asleep, and then go back to bed. But I wouldn't recommend or wouldn't suggest that you just lay there, because that's not going to get you anywhere, and it's probably a lot of anxiety and frustration. So I would say, yes, remove yourself from the bed and sit up for a few moments until you fall back to sleep.
Do you have any suggestions about, are there foods that you should avoid, or foods that you can eat that help sleep or hinder sleep? I know caffeine, but I didn't know if there were other foods that besides coffee.
I do know of no caffeine, but as far as foods, I'm not an expert, so I don't want to suggest something that may not be counterindicated. So I really can't answer that question about the foods, but I know definitely you don't want to drink alcohol. You don't want to drink caffeinated beverages or coffee, because that would definitely not get the results you're looking for as going to sleep. So you want to stay away from those things. But as far as food, I don't really have an answer. And I'm sorry I don't have an answer for that. But that's something you can always check with a dietitian or someone, foods, or you can always look that up in the social media websites to see what's a better fit.
Okay. And then I guess one last question that I see here. The So you mentioned at home sleep studies. If But Valley has a sleep lab, right? Can you talk a little bit about that experience?
The experience with the Valley Sleep Lab.
Like what it looks like, or is it? I mean, I did a sleep study 15 years ago, but um, I didn't know if the place has changed. It kind of looks like a hotel room, right?
Absolutely, you nailed it. Actually, our sleep center is you have private rooms and you have your own personal bathroom, and it is somewhat like a hotel room. You have the let's see, yes, you have monitor that the sleep tech will watch you during the night to monitor your movement. And then you have wires that are placed on your head, and that's also to give you to read the information that's going on while you're sleeping. But the rooms are very nice. It's very quiet there at the sleep lab. Believe it or not, a lot of people have apprehension of sleeping and sleeping somewhere else. But I always tell them when you go there, by the time they apply all the wires and everything that's needed to secure a good monitoring, you're tired. You're ready to go to bed. You're like, are you finished yet? Because you're ready to lay down. And before you know it, I've had patients when it's time to wake up at 5:30 in the morning, because that's the time they generally wake you up between 5:30 and 6 o'clock the next morning. They can't believe they slept the entire time. They can't believe they slept that long and in another bed. So I think basically just to go with an open mind with our sleep lab is very comfortable, and you want to get the best results as far as what's going with you. So I definitely would recommend, if you can go to a sleep lab, absolutely. Our sleep labs are comfortable, and we have very highly trained technicians that monitor you all night. So people say, somebody's watching me. Yes, they're watching you, but they're not watching you to see how you sleep. They're watching to see what's going on with your body, and so that they can better read that, so the doctors can better diagnose what actually, if it's obstructive sleep apnea or central apnea, which I did not mention, or some other sleep disorder that you may be diagnosed with.
Okay, thank you.